Hello everyone, I am Dr. Abhishek, Associate Consultant in the Department of Neurosurgery working in Manipal Hospital Sarjapur Road. And we are come here today to talk about impact of digital life on brain health. And we have today Dr. Ajay Hegde, Consultant Neurosurgeon in the Department of Neurosurgery working in Manipal Hospital Sarjapur Road. As we are seeing, as India is becoming more digitalized, so the screen time of including the mobiles, the laptops, everything is increasing. So, is there any impact of it on the brain? So, we'll find out today. So, sir, can you discuss the neurological mechanisms behind how prolonged screen time can lead to changes in brain structure and function?
Thank you, Abhishek. I think in today's world, this effect of excessive digital usage on not only brain health, all the aspects of human health is very important, and I'm glad that I can touch upon this aspect in pertinity to the brain. So definitely excessive usage of digital devices affects brain health, and there are several mechanisms and several theories that are proposed as to how they affect them. One of them is it alters brain plasticity. So our brain is a very dynamic structure wherein new connections are being formed regularly, old connections are being broken, new memories are stored, old memories are erased. So excessive screen time, especially in children and adolescents, can alter this normal process, which can have very long-standing effects. The other thing is dopamine release. So we all know that dopamine is it's a reward hormone. So the dopamine fluctuates on a daily basis depending upon the person's activities. So with excessive usage of these mobile phones and all, what happens is there is desensitization of the dopamine receptors. So they don't know when to expect a reward, when to expect failure. So that is one more aspect of it. Then blue light usage, we've all read, we've all seen that excessive blue light can again alter sleep rhythm pattern, can affect melatonin release, and it can also cause insomnia and other effects. This again has long-standing effects on the brain and its structure. And one more aspect is our brain is composed of gray matter and white matter, as we all know from school days. So there is a loss of gray matter when you use more of these digital devices, especially prolonged screen time with YouTube and all the other newer things which come in today. So these are few mechanisms I would like to highlight on.
So, sir, what specific areas of brain are most affected by this excessive usage of screen time?
Okay. So today, because of the advances in MRI and electroencephalography and all the newer modalities of imaging, a lot of research has been done to find out which specific area is affected in digital overload, if we have to call it. So one of them is the prefrontal cortex. So the prefrontal cortex is a part of what we call the frontal lobe, which is involved in behavior. A lot of personality comes from the prefrontal cortex. So excessive screen time, what it does is it desensitizes your own personality and causes permanent changes in this prefrontal cortex, which can result in behavioral changes. Then the other part is hippocampus. The hippocampus is again a structure deep-seated within the temporal lobe, and alterations in this can cause alterations in emotion and thinking and even a little bit of the personality. There is a specific area called the cingulate gyrus, which works with emotion. So a lot of again devices usage can blunt emotions, blunt emotional responses, which causes long-term effects on this area too. The other areas, if you have to just enumerate, probably the insula, which is again a very important part of the emotional pathway and the emotion and other final.
So, sir, we have seen that screens emit blue light. So, how does the blue light emitted from the screens influence circadian rhythm and sleep patterns at a neurobiological level?
Yeah, I think blue light has been the public know about it very well, because most phones and all our laptops now have something called as a dark mode, or to reduce the blue light they have a yellowish tinge which can automatically come up at night time. So blue light acts on the brain through certain mechanisms, and especially the use of blue light during the evenings and night is what alters something called the circadian rhythm. And this circadian rhythm is controlled by a specific structure in the brain, and in the brain there is a specific structure called the hypothalamus, and in the hypothalamus we have something called the suprachiasmatic nucleus, which is like a master clock. So this nucleus knows when it is day, when it is night, based on your sleep cycles, considering that you sleep at night and you are awake during the day. So blue light kind of alters this cycle, and your suprachiasmatic nucleus thinks that in the night when you are looking at excessive mobile phone or laptop usage, it thinks that it is still daytime, and this can cause deactivation of this. And so basically what happens is you fail to sleep at the right time because your body still thinks it is daytime. The other thing is melatonin. So we've all known that melatonin is the sleep hormone. So blue light is known to suppress the secretion of melatonin, and when melatonin is suppressed, again you don't fall asleep at the right time, and because you don't fall asleep at the right time, you start sleeping during the daytime, and it affects your work, it affects your day-to-day activities, it affects your interpersonal relationships. You tend to get angry, it results in emotional liability and all these things. So I think blue light, I think the simplest way is to switch off blue light or enable dark mode in your mobile phones, so that you can make sure your body is in sync with your phones.
So that's a very good suggestion, sir. So are there any specific cognitive exercises or any specific interventions that we can do that can negate the effects of this prolonged screen time in the brain?
Yeah, definitely. I think we all should start with having a stress-free workplace, which I think is the most one of the most important causes of stress. And there are a lot of, we all know meditation can help de-stress and take time away from all these activities. So meditation, yoga, these are very good relaxation techniques. The other thing is engaging your mind in something more creative and analytic, like playing some brain training games like Sudoku, chess or Scrabble, where you have to train your brain, and probably moving out of digital devices and picking up a book and reading a book, rather than, because when you read something on the mobile or the computer, you have a lot of distractions and you can always switch screens, go to the next screen, and then you're just bombarded with a lot of thoughts. Like you read a book on your phone and then suddenly somebody calls you. So holding a book and reading, I think, will distract you and remove all those distractions, and this definitely should help. And the other things are parental. I think parents should make sure that children are not excessively exposed to mobile phones and especially YouTube and all the other content available online for prolonged periods. Although they have their own advantages, I think the disadvantages are several in these things. So the other thing is a regular routine for physical exercise, either running, swimming, for cardiovascular health, as well as some core body training exercises. This also releases a lot of hormones which are responsible to maintain a healthy brain. And I think today we have, although we have to stay away from digital devices, there are a lot of digital apps available which can help us have a fixed schedule for exercises or any yoga, meditation, anything. So I think using the right apps in the right moderation is the key to having a successful life balance, especially with brain health.
So as we came to know, using the devices at the right time, in the right amount of time, is the key for our health and for our well-being and for others. So that is what we should be following, as we already came to know. Thank you for the information, sir.
Thanks, Abhishek.